Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the two radiology lectures of this block. So bismillah, let's start. First of all, we need to know that this lecture we're going to cover the plain x-rays, the CT scans, MRI and ultrasounds. These three, we're going to talk about them very briefly at the end of the lecture. The main focus is going to be on the plain x-ray. Tamam? So the plain x-ray is also known as the radiograph. So another name for the plain x-ray is the radiograph. And it's one of the methods that does not require any contrast or dye or الصبغة اللي بنضيفها للجسم, so the organs are more clear and the structures are more clear, is not required when taking a plain x-ray. تمام? So the plain x-ray is the technique of the plain x-ray is very important, or the way we take the plain x-ray is very important. Why? لأنه the physician is going to read this x-ray and diagnose the patient accordingly, right? So if the technique used to take the x-ray is incorrect, that means the patient is going to get a wrong diagnosis. So now let's see the correct techniques or the correct ways of taking the plain x-ray, the plain chest x-ray. So for the chest x-ray, we have three views. We have the PA view, the lateral view, and the AP view. So posterior, anterior view, lateral view and anterior posterior view. Let's see the difference, okay? First of all, and the most important view is the PA view, which is the posterior anterior. From its name, posterior anterior means the radiations pass from the back, like from the posterior of the body to the anterior, and from the vertebra to the sternum, from the vertebra to the ribs, okay? So from the posterior to the anterior, this is the first and most important view, okay? How is this view taken? What's the position the patient must be in? The position is upright or erect position. The patient has to be either standing or sitting down. The most important thing, the patient has to be in an upright position, okay? And then the patient is asked to fully inspire air. Why do we ask the patient to fully inspire air? Because we want to take the maximum area of the lungs, or we want to have the best view. So how are you going to have the maximum view of the lungs or the chest area? It's by letting the patient to inspire maximum air, so the diaphragm will contract and move downward, so we're going to have more space, okay? So anything highlighted in green is the correct method or the correct thing we have to do. Anything highlighted in red means it's something we need to avoid or the wrong way. So since we said the correct position is upright or erect and the patient has to fully inspire, that means the opposite, which is expiration, is wrong. If the x-ray image is taken while the patient is expiring, we're gonna get a very unclear image. Why? لأنه the lung base is gonna appear very hazy. We're gonna see it now. The lung base is gonna appear very hazy and the heart opacity is gonna increase in size. So what do we mean by that? This image is a perfect image, okay? So here we can see the base of the lung is very clear. We can identify it, and this is the diaphragm as well. Everything is clear. And then here we have the heart. It's also very clear. This is the diameter of the heart, right? Now let's see when the patient is expiring. Let's see the image taken when a patient is expiring. So here, as we said, this is the same or a similar image to the one above. When the patient is inspiring, it's the correct position. Everything is right. Here we can see the heart. This is the diameter of the heart, and here's the base of the lung. Tamam? Now here on the other side, we can see this is the incorrect method. Why? Because the patient is expiring. So what happened? First of all, we can't really identify the base of the lung. It's a very hazy base. We can't really point it out, okay? The second thing is that the heart has increased and the diameter of the heart has increased. Okay, so the size of the heart has increased. Is this correct? No. This is a very false image of the heart. So it gives us a false size of the heart, while in reality this is actually the size of the heart. Okay, so you can see there's a huge difference in the diameter of the heart. Okay, this is only because we took the image while the patient was expiring, not inspiring. Tamam? So we said that the first and most important view is the PA view, which is the posterior anterior view, and the patient has to be in upright position, erect, standing or sitting, and they have to fully inspire air when taking the image, okay? Then we have to avoid expiration because of the two reasons we said, that the lung base is going to appear hazy and the heart opacity increases in size. Tamam? Then the other view, the second view, is the lateral view. The lateral view, from its name, it's going to be from the sides, right? So we might say here, okay, خلاص, since it's from the sides, then we can take it from either sides, either right or left. No, we have to start from the right. Why? لأنه the same problem that we faced here regarding the heart. The heart is on the left side, right? So that's why we have to start the radiations, or the radiations have to enter from the right and go through and go out from the left. Why? So we avoid magnification of the heart. So we have the heart in the same size, so we don't see the heart in a magnified shape, okay? Second thing we need to know here, if you realize that it's more light or bright here, and then as we move downward, the image gets darker, right? So here it says that the vertebra is more transradiant or blacker or darker in color as we move down the image, okay? Then we have the third and last view, which is the AP view, the anterior-posterior view. So it's opposite to the one here we said. So the posterior-anterior view is the most important view, and it's more than enough to be used alone. If we want to add, optionally, we can add the lateral view that we just mentioned to it, okay? However, the AP view, or the anterior-posterior view, which is the opposite, which we allow the radiations to go in from the anterior side to the posterior, yani from the sternum, the ribs, to the vertebra. This position, or this view, is only used with patients who come to the ER and they can't stand up, or the patients in coma. So we can't put them in the upright or in an erect position, okay? So this is the only time we use the AP view, because it's considered the least accurate view. Why is it considered the least accurate view? Because when the patient is in the supine position, there's the abdomen and the intestine and everything underneath the diaphragm. So when the diaphragm wants to contract or wants to move downward, right, when the patient inspires air and the diaphragm wants to move downward, these organs underneath the diaphragm, which are like the stomach and the intestine, restrict the movement of the diaphragm. Yani they allow it to move less than when the person is in the upright position, because of gravity, basically. And when the person is in an upright position, these organs are already pulled down and the diaphragm contracts down as well with gravity. But when the person is in their supine position like this, it's against gravity. Tamam? Okay, so moving on, here we have a comparison between PA and AP view, okay? We're going to come back to them just after this slide, okay? So here in this slide, we can see برضو the AP and the PA. And by now we know that the AP is the one that we don't prefer and we only use in certain conditions with certain patients, while the PA is the one that we prefer and it's the most commonly used view, okay? So here we can see the medial border of the scapula. So if you realize between the two, if you notice between the two black lines, there's a very thin and faded white line. So this is the scapula, tamam? This is the medial border of the scapula. So the medial border of the scapula is here, and it covers almost half of the lungs, okay? On both sides as well here, okay? So this is on the AP view. So this is a disadvantage for the AP view. While on the PA view, it only covers the lateral surface or the lateral part of the lung, which doesn't really affect the reading or the scan in general, okay? The image in general, okay? So now let's see the difference between PA and AP. So PA قلنا is the standard and routine chest radiograph. AP is done only in emergencies. PA, no magnification of the heart. AP has a magnification of the heart and the mediastinum. So in mediastinum and heart, both are enlarged and they look, they're magnified basically, okay, in the AP view. The lung field is very clear in the PA view, while on the AP view, it's not very clear. And then we just saw the scapula now. So the scapula are not in the lung field. They're on the side or in the lateral part. While in the AP view, the scapula are in the lung field and they do affect the image, okay? Here it's easy to read and here it's difficult to interpret. As we can see here, there's a note, AP view is less useful and should be reserved for only ill patients who can't stand erect position. Tamam? طيب, moving on, we have the technical factors. So we have 3 very important technical factors. So we have to make sure these technical factors are set before we start taking the image, okay? So what are they? First thing, we have the exposure or penetration. Then we have the inspiration. We mentioned the inspiration, but we're going to talk about it in more details. And then the last thing is the rotation or the position, okay? So starting off with the exposure or penetration. What is the exposure or penetration? It's the amount of radiation that passes through the patient, okay? So do we have a set amount of radiation that passes through all the patients? No. Why? Because we need to decide on the amount of radiation according to the patient's size. So if we have, for example, an overweight patient, we can't give that patient the same amount of radiation that we give to a child or that we give to a skinny person, for example, okay? So here we can see 3 different images, but they're from the same patient. And it is the same patient, but we gave him 3 different amount of radiation. So we can see how the radiation or how the amount of radiation matters and how much it makes a big difference, right? So if we have to choose one of these 3 images, which one would be the best one? It would be this one, right? Why or how did we decide on that? Let's see. So we're going to use the spine as our reference, tamam? So the spine is going to be our reference so we can decide whether this exposure is the right exposure for this patient or not. Okay, so adequate means this is the correct exposure for the patient and this is the perfect amount of radiation for this patient. Over is over, yani overexposure, the radiation is more than the patient's need, and under it means the radiation is less than what the patient needs. Okay, so for the adequate or for the accurate and correct exposure for the patient, the vertebrae are going to be barely visible through the heart shadow. And هنا this is the heart we said. So هنا according to the heart shadow or the vertebrae close to the heart, they're going to be visible but they're not very clear. يعني we can't really see the details, but they're visible and we can see them. Okay, so this is for the adequate or the perfect exposure. And one extra information from me, this is not from the slide, it looks gray. It's more of like, it's not very black and it's not white, it's gray. Okay, so you can see it's like gray compared to the other 2 images. So we can remember this one is the adequate or the perfect exposure for this patient. Okay, why, if the doctor asks why is this the adequate exposure, it's because the spine is barely visible through the heart shadow. Okay, the spine is barely visible through the heart shadow. Tamam? Next, let's move to the over exposure or over penetration. Over penetration from the doctor said the way we can remember it إنه لما نعطي patient too much radiation بينحرق، فلما ينحرق البيشنت بيصير لونه أسود. Okay, so when we give over radiation, the patient is gonna get burned, right? So that's why it's gonna appear black. So that's why for the over radiation or the over exposure, the image is going to appear black. And according to the spine, because we said the spine is going to be our reference, the spine and disc spaces are visible. And here we can see the spine and we can see the disc spaces between. Okay, so here we said for the adequate, it's barely visible through the heart shadow. Here for the overexposure, the spine and disc spaces are visible. Okay, the last image, which is the underexposure or the less exposure, less penetration, it's going to appear very white and very bright. Okay, so it's very white and very bright, and the spine, so we said we're going to use the spine as our reference, the spine is not even visible. So the spine is not visible at all. Okay, so the spine is not visible in the underexposure or under radiation. Tamam? Then let's move to the next thing that we said is the inspiration. So we spoke about the inspiration. We said we asked the patient to inspire so we can have a better view of the lungs, right? And what does this give us? It gives us the lower border of the lung, which is very clear here in the inspiration. And we said the expiration is the opposite. It gives us a very hazy base of the lung, and the heart is enlarged or magnified. Tamam? This is what we mentioned above. Now we're going to add one little information, which is when the patient inspires here in the inspiration. How do we know the patient inspired full inspiration, or the inspiration that this patient has inspired is enough for the image? How do we know that? By counting the spaces or the ribs. تمام. So if the patient inspired well, or if this is, how do we know that this is a perfect image or a good image? The level of the lower border of the lung is going to be against the 8th or 9th or 10th rib. So how are we going to see this? Let's see it here. Here we're going to count the ribs. So this is the posterior view, right? So we know this is the PA view. PA view. So here we can see the ribs from behind, from the posterior view. So the first rib is not very clear here. Then we have the second rib, the third rib, the fourth rib, fifth, sixth, seventh, eighth, ninth, and then here the 10th, we can't really see it because of the lower border of the lung. So as long as it's in between the 8th to all the way to the 10th rib, then here we can say this is a perfect image and inspiration is successful. Okay? So طالما ال lower border حق اللung is against the 8th or 9th or 10th rib, then that means we have a perfect image and inspiration is successful. Okay? The last thing is the position or the rotation. So what do we mean by this? We mean that here we can see in this image here, when the patient is asked to stand in an upright position, the two shoulders have to be against the device and they have to be straight. يعني the patient may يميل على جهة معينة. The patient shouldn't be slanted against one side. The patient should be in a straight upright position. Okay? So how are we gonna know, or how can we see when reading the x-ray and know that this patient was in the right position or in a straight position, or the patient was rotated a little bit? How do we know that from the image? It says that the medial ends of both clavicles should be equidistant from the midline spine. What does this mean? That means هنا, where is it? Yes, here we can see. So these are the two medial ends of the clavicle. So these are the medial ends of the clavicle. And this here is the midline spine. So the distance between the midline spine and the medial end of the clavicle on both sides has to be the same. If they're the same, like here in this image, we can say that the patient was stood in an upright position and there was no rotation. So this is a perfect image, okay? Because the distance here is equal. Amma, the opposite, if we see here, these are the medial ends of the clavicle and this is the midline spine. So as we can see here, the distance is not equal on both sides. That means the patient was slightly rotated or shifted to one side. Tamam? So here from this image, we can tell that the patient was not stood in a straight position and there was some rotation. Okay? So now let's see which structures appear, or which structures we can see inside the lungs. We have three structures that could be visible inside the lungs. First one are the blood vessels, then the interlobular fissures, and the walls of certain bronchi. But the fissures and walls of certain bronchi are not always visible. But the ones that are always visible or mostly visible are the blood vessels. And here we can see them here. They're usually towards the center of the lung. يعني هنا this is the lateral part of the lung and this is the medial part of the lung. So they're usually towards the center. So you can see the ones inside the orange circle are the blood vessels. All these are the blood vessels. تمام? Then let's see the fissures. So the fissures, it says here that the horizontal fissure is usually seen in the frontal projection or the PA view. And in the PA view, we can see the horizontal fissure. How does it appear? It appears as a very thin line running from the right hilum to the 6th rib. Okay, let's see it here. So here, it's a very thin line. If you really pay attention, you can see it. It's a very, very thin line here. Okay, so it's a very thin white line that appears between the right hilum and the 6th rib. تمام? Then we have the oblique fissure. The oblique fissure only appears in the lateral view. So we can only see it from the side. So let's see it here. We can see it here. This is the oblique fissure. تمام? So the oblique fissure is seen from the lateral view. تمام? بعدين it says here a very important note. What is it? Sometimes or usually the skin lumps or nipples are mistaken for pulmonary nodules. Yani when reading the x-ray, you should be very careful not to mistake the skin lumps or plates of hair or nipples and think that they are the pulmonary nodules. Why? Because they look very similar, okay? But how do we differentiate between them? And if you see this structure that you don't know what it is, let's imagine you don't know what this is right now. Is it a pulmonary nodule? Is it a hair? Whatever. You're gonna see if it's against the 5th anterior rib space. Yani if it's in the 5th anterior rib space and it's found on both sides, then it's most probably either part of the breast or plates of hair because it's found on both sides. However, if you only see it on one side, then it's most probably إيش pulmonary nodule. Okay, this is just a note to remember, just not to mistake them. That's it. That's all you need to know here. Then we have the trachea. The trachea is usually in the midway. The trachea is usually in the midway, as we know anatomically, that's the position, and it's slightly towards the right side. تمام? We can find it between the medial ends of the clavicle. Let's see it here. Here, this is the trachea. تمام? So you can see the trachea here, but you can't see it here. Why? لأنه you start seeing the vertebra, so they start to like the colors go in and they contrast, so you can't really differentiate between the trachea and the vertebrae here. Now let's see the last structure we have, which is the diaphragm. Okay, where is the diaphragm? Here. So the diaphragm is clearly visible from the costophrenic angle to the other, from the right costophrenic angle to the left costophrenic angle, except in the area where the heart and mediastinum are, because they contrast together and the diaphragm is not visible. Let's see this on the image. So the ones in orange are the costophrenic angles. The costophrenic angle has to be very sharp, as seen here in this image. If the costophrenic angle is not sharp, that means there's something wrong. The normal is that the costophrenic angle has to be sharp, okay? So here we have the right and left costophrenic angles. How do we know? This is the right and this is the left. How did we know? Because the heart. Here we can see the heart is usually on the left side, right? So here we can see the heart. So this is going to be the left side and this is the right side, okay? So this is the right costophrenic angle and this is the left costophrenic angle. Where's the diaphragm? The diaphragm has to be from this angle all the way to the other angle. So this is the diaphragm, okay? Here we can't see it, as we said. Why? Because the heart and the vertebra, they all appear as the same color on the x-ray. So that's why we can't really differentiate where exactly the diaphragm is, but it's somewhere here, okay? And usually on the right side, the diaphragm is higher than on the left. Tamam? So here, this is almost everything we said and everything mentioned in the slides above. If you want to go through it, you can. But it's everything we just explained, okay? Here, this is also just a diagram for understanding, yani. We studied this in anatomy already, but it's just to make things more clear. Okay, now we have a very important part. This is probably going to be in the OSPI, and it is already in the OSPI file. So it's very easy. You have to just understand it and you're going to be able to answer any question, okay? So this is a lateral view. As we can see, this is the breast here and this is the back, the vertebra, tamam, and this is the chest area. So this is a lateral view, okay? And this is a lateral view as well, okay? So these two are lateral views. One of them is right and one of them is left. How are we going to differentiate with the fissures? The fissures are going to show us, and this is right or left side, tamam? So the oblique fissure usually shows on. So the oblique fissure is usually seen on the lateral view. So we can't really see the oblique fissure from the PA view. So this is the oblique fissure here, and then this is the minor fissure. طالما we have two fissures, that means we're on the right side. Whenever we see two fissures, that means we're on the right side, right? So anything that's gonna be anterior to the oblique fissure, يعني in front of the oblique fissure, this is the back, we said this is the vertebra. So this is the anterior of the oblique and this is the posterior of the oblique. Anything anterior to the oblique and above the minor fissure is also the transverse fissure, as we also studied it in anatomy. But here they call it minor and major. And major means the oblique, and we can either say oblique fissure or major fissure, and we can either say transverse or horizontal or minor fissure. كلهم نفس الشيء. Okay, they're all the same thing. So anything anterior to the oblique fissure, superior to the minor fissure or transverse fissure, is going to be the upper lobe of the right lung. So anything anterior to the oblique fissure but inferior to the transverse or minor fissure is going to be the middle lobe of the right lung. تمام? And anything posterior to the oblique fissure is going to be the lower lobe of the right lung. Same thing here. We have the oblique fissure or the major fissure, as they said here. So anything anterior to the oblique fissure, we said this is the vertebra and this is the anterior part of the patient. So anything anterior to the major fissure or to the oblique fissure is going to be the upper lobe of the left lung or the left upper lobe. We can either say right upper lobe or upper lobe of right lung, same thing. So left upper lobe or upper lobe of the left lung. Anything posterior to the oblique fissure or major fissure is going to be the lower lobe of the left lung or the left lower lobe. Okay? But here we can see the images that we'll probably get in the OSPI. Okay? So in the OSPI, obviously there won't be any writing here, like this writing won't be here, but it's just gonna have the blue shadow, and we have to identify which lobe this is. So how are we gonna know? This is the lateral view as we saw here above. It's the same view, but so this one is the PA view. تمام? This is the PA view. So how are we gonna know? أول شيء, if we see the PA view, that means we're not gonna be able to see the oblique fissure. We're only gonna be able to see the minor fissure or the transverse fissure. لأنه the oblique fissure, as we said above, is only seen in the lateral view. So once we see the PA view, that means this is the minor fissure or the transverse fissure or the horizontal fissure, whatever you want to call it. So first of all, how are we going to know the right and left side? If we see in this view, the PA view, once we see the height, that means this is the left side. تمام? So once we see the height here, that means this is the left side, and هنا this is the right side. So كده عرفنا right and left. Okay. Now let's see the upper and lower lobes, or which lobe. How do we know which lobe it is? طالما we can see this fissure here, we can only see the transverse fissure on the right side, because we don't have a transverse fissure on the left side, right? So the transverse fissure or the minor fissure is seen on the right side. So anything above it, we said, what's above the transverse fissure or the minor fissure, it's the upper lobe. Okay, we said it here. So anything above the minor fissure is going to be the upper lobe. So this is going to be the right upper lobe, tamam, or the upper lobe of the right lung. Here, same thing here. We said anything anterior to the oblique fissure, superior to the transverse fissure, is going to be برضو the upper lobe of the right lung or the right upper lobe. Here we can see same thing, underneath the minor fissure is going to be the middle lobe. We said it here. So anything underneath the minor fissure is going to be the middle lobe. تمام? This is in the PA view. But then in the other view, the lateral view, we said anything anterior to the oblique fissure and inferior to the transverse fissure is going to be برضو the middle lobe. Okay, the middle lobe of the right lung or the right middle lobe. تمام? Then let's move to the lower lobe. The lower lobe, anything we said here, this is how you're gonna get it in the exam. If you get this, the whole area shaded كده, and we said we know this is the left side, then we can see the height, and this is the right side. So this is gonna be the right lower lobe. Okay, the right lower lobe. Why can't we see any fissure? And we said the oblique fissure is only seen here in the lateral view, and this is the PA view. So we can't see the fissure here لأنه the right lower lobe is underneath or posterior to the oblique fissure. So we can't see the fissure in this view, but we can see it here. تمام? So if you get this is إيش? The right lower lobe. If you get this, and if you can see the fissure underneath the fissure or posterior to the fissure, is going to be the right lower lobe or the lower lobe of the right lung. Now let's move to the left. We're done with the right. The left, we know it has only one fissure, which is the major fissure or the oblique fissure. So that means it's not going to be seen on the PA view. We can't see it لأنه the oblique fissure is not seen on the PA view, but we can see it when bilateral view. So هنا bilateral view, this is the oblique fissure, تمام, or the major fissure. So gonna anything above the major fissure or anterior to the major fissure is gonna be the left upper lobe. Anything posterior to the oblique fissure or the major fissure is gonna be the left lower lobe. Here we can see the left lower lobe. But then in the other view, the PA view, we can see here the height is not seen. The height is on this side. That means this is the left side. So خلاص طالما the height is on this side, that means this is the left side. So the left upper lobe. Okay, this is the left upper lobe. If you get this image, here there's no blue shadow. That means this is the left lower lobe. So this is the left lower lobe. But then we can see the height is here, so that we know this is the left side. Now, last thing we have for the X-ray or the plain X-ray are identifying the bony fragments and the soft tissues. Okay, so for the bony fragments, we need to know these bony fragments: the ribs, sternum, spine, shoulder girdle, or clavicle. Type. So let's see them really quickly. First of all, we know this is the PA view and this is the lateral view, right? So for the lateral view, here we can see the sternum. It's very clear. And for the PA view, we can also see it, but it's not very clear here because it overlaps with the heart and the vertebra. Okay, because they're all the same color. So we can't really see it very clearly in the PA view. But then we have the ribs here. The ribs are very clear in the PA view. And the vertebrae are seen on both views as well. So we can see the vertebrae here. And then the last thing, the shoulder girdle, the doctor didn't really mention it. Well, clavicle is here. We can see this is the clavicle. Tamam? So this is the clavicle. Okay? Okay, now let's see the soft tissues. For the soft tissues, what do we need to know for the soft tissue? We need to know, this is the breast shadow, okay, or the shadow of the breast, and it appears as white. It appears very white and bright in the X-ray or in the image, okay? And why does it appear white or very bright? لأنه it's soft tissue, right? So the soft tissue is going to appear white or light in color. So when a patient has mastectomy or removal of breast, what happens? The soft tissue amount will reduce or it will decrease, right? That's why the color will become darker. So it will increase in transradiancy, which means it will become more darker or more black. So here you can see this area is darker than the rest of the breast, right? So this means that this area there was removal of the breast or mastectomy. تمام؟ طيب كده we're done with everything to do with the X-ray. These 2 slides are for revision. You can use them for revision. Not everything here has to be known. Just use them for revision. تمام؟ Now let's move to the CT. طيب the CT scan عكس ال X-ray. قلنا في X-ray, we said in the X-ray we don't need to use any contrast or any sort of dye or صبغة. But for CT we can use it. Why do we use it or when do we use it? We use it when we want to visualize or want to see the mediastinum or pulmonary blood vessels. طيب? Because when we use this contrast, it dyes or it makes the blood vessels more visible and it makes them turn white. So that's why we can see them more clearly. So we use it when we want to see the mediastinum or the pulmonary blood vessels. Okay? Here these images are very important because they're in the OSPI file as well, so we're probably going to get one of them. So we need to differentiate between the mediastinal window and the lung window. So these 2 are the same. They're both the lung window, and these 2 are the same. They're the mediastinum window. How are you going to remember it? This is just a way to remember it, okay? The mediastinum window, mediastinum means midnight. لما يكون midnight, خلاص آخر الليل, it's dark, it's very dark, it's black, everything is dark, right? So mediastinum window is very dark, okay? It's very dark, it's black. The lung window is grayish, يعني it's not very dark. You can see إنه هنا it's more lighter than the mediastinum window. But actually the correct answer, if asked in the exam, why is this the mediastinum window, you're going to say, if the doctor asks what is this image مبدئيا كده, it's going to be the mediastinum window. Why is it? Because no details of the lung parenchyma are clear. تمام? However, in the lung window have very clear lung parenchyma. تمام? Then these 2 images are the same exact thing. These 2 slides have the same thing I just said. That's just the images magnified. تمام? Now let's move to the MRI. The MRI is not usually the best option for managing pulmonary or pleural diseases, okay? But when do we use it? We use it in 2 conditions. We either use it usually in apical tumors if the CT did not help us. يعني if the CT did not answer any questions we have or the relevant questions, then we move to MRI. But it's not usually the first method we use. يعني we usually use the CT first. If we couldn't figure out anything from the CT, then we move to the MRI. The second thing or the second condition where we use the MRI is for pregnant women. Why? Then it's a good alternative since it has no radiation. So it's not going to be of any harm for pregnant women. تمام? Here we have to differentiate between MRI or CT. How are we going to differentiate? It's very easy and simple, okay? We have 4 images. Imagine you can't see the answers, okay? We have 4 images. How are you going to know this is a CT or this is an MRI? We're going to look at the bones. The bones we have in the thoracic cavity are the sternum, the vertebra, the ribs, all of these bones, right? If you see the bones as white, يعني white, not gray, لا, white very clearly, that means this is a CT. أول ما نشوف الbones gray or black or a bit darker, that means they're MRI. So here we can see this is the sternum, this is the vertebra, these are the ribs, okay? All the bones appear very white. That means this is a CT. أول ما نشوف هنا the bones are like gray, they're a bit darker, okay? These are all MRIs, okay? Then the last thing we have is the ultrasound. The ultrasound is a very simple and cute method, okay? So we don't really use it in the major or big things. We use it in pleural effusion, pleural masses, mediastinal masses, and so on. And the most important thing for the ultrasound is we use it for guidance of the needle. Yani if you want to insert a needle in the thoracic cavity, for example, for draining pleural fluid, for a needle biopsy, all of anything that has a needle, anything that we want to insert a needle, we're going to use an ultrasound. ليش? It's going to guide us through and show us where exactly to insert the needle, so we don't insert the needle in a wrong position. Okay, so by that we're done with the lecture. We have here 2 cases or 2 questions. Which statement regarding the X-ray technique is false? So let's go over them quickly. There are 3 technical factors We said inspiration, penetration, and rotation. This is correct. Okay, penetration refers to the number of X-ray passing through the evaluated area. Correct. لأنه we said penetration means the quantity of X-ray or the quantity of radiation passing through. بعدين lower inspiration results in haziness of the lung base. We said إنه anything less than the full inspiration يعني expiration, lower inspiration, كل هذولي the base is gonna appear as hazy, and the heart is gonna be magnified. Okay, so this is also correct. The medial end of the clavicle should be equidistant from the spinous process. This is also correct. This is this shows us if the patient was rotating or if he was in a straight position. The incorrect one is an underpenetrated film appears too dark. غلط. ليش؟ لأنه we said under penetration the image becomes very bright and white, right? But when it becomes too dark, that means the patient received too much radiation, so the patient got burnt من كتر radiation. So that means it's gonna appear here. The correct answer is this is gonna appear light, not dark, too light. Okay. Then the second question here, we said chest X-ray, the right side of the lung looks hyperlucent and the other side, which is the left side, looks lucent. What does lucent mean? Also, lucent means black. Okay, so normally the lung appears black, right? لأنه it's filled with air. So the normal is it appears lucent, not hyperlucent. Hyperlucent معناه في شيء غلط. There's an abnormality. So طالما it appears lucent, that means the left side is the normal lung. So which of the following is true? مبدئيا anything with both is going to be wrong لأنه one of them is abnormal. So both is wrong. It's either the right side is normal or the left side is normal. We said hyperlucent means there's an abnormality, so that means the left side is the normal side.